Welcome to the Chaos Whispers of Healthcare, the podcast for busy healthcare leaders who are ready to get out of survival mode so they can focus on what matters most. This is where the burnout stops and the real talk starts. I'm your host, Dr. Megan Carter, and each week I sit down with healthcare innovators who get it. We will unpack the chaos, laugh through the hard stuff, and get you at least 2 practical tips you can use at work right away. If you're ready to clear the chaos and lead with impact, you've come to the right place. Let's jump in. Welcome back to the Chaos Whispers of Healthcare, the podcast for busy healthcare leaders who are ready to clear the chaos and lead with impact. I'm your host, Dr. Megan Carter, and today we are talking about something that gets talked about a lot in healthcare, but it rarely is implemented in a way that actually sticks. Today, I am joined by Dr. Bryan Sexton, who is a national leader in healthcare well-being and the work behind the Duke Center for the Advancement of Wellbeing Science. Dr. Sexton is the Chief Wellness Officer for Duke Health Integrative Practice. Now, I first connected with Bryan during my DNP program at Duke back in 2019. And at that time, my project focused on nurse manager resilience. And we used his WISER tool as our intervention, which we'll touch on here later. Halfway through, though, 2020 hit. So, of course, as I'm trying to implement this project, we experienced the pandemic. So we had to pivot and rename the project Nurse Manager Resilience in a Pandemic, which was ironic. And even in that chaotic environment, we actually saw measurable improvements in our nurse manager pilot group, which just proved to me how valuable and impactful his approach and these tools actually are. So welcome to the show, Bryan. We're so excited to have you.
Thank you for having me. I'm looking forward to this.
Love it, love it. Let's start here. What's something about healthcare leader well-being that most people think is true, but actually isn't?
Something about healthcare worker well-being?
Mm-hmm.
Something that leaders do frequently that I find kind of amusing. And it's a shame because we have these expectations that are kind of ill-informed. If I had a nickel for every time a nurse manager said to me, I can't talk about burnout with the nurses. If I do that, all they do is that's all they want to talk about. If I talk about burnout, I cause them to get burned out. Suddenly, all they ever want to talk about is burnout. So I caused the burnout. I'm like, no. That does not mean what I think that does not mean what you think it means. Actually, what's happening is if you create a safe enough space for a nurse to say, I'm struggling with this.
Right.
You're opening the floodgates for what they've been holding back for a long time.
Yeah.
It's not that you caused burnout. The burnout's still there. It's there whether you give it space or not. But if you give it space, you create an opportunity for it to heal.
That is fascinating. That's such a great point. And that's not the first time I've heard that. So totally agree with that assessment. Yeah, we want to create the space for them, but also because we're drowning ourselves as healthcare leaders, sometimes we're like, is this the time and place for me to open that can of worms? So I love that we're going to talk about practical strategies to help them guide those conversations today.
I mean, imagine for a second, all the nurse managers who feel guilty that by talking about it openly, they feel like they caused it. I have to walk them back from that, not infrequently. So that's not what happened here.
Yeah.
But they feel they really feel a sense of ownership. I want to channel that into what to do about it.
Yes.
And not all this kind of like misplaced self-blame.
I love that. Thank you for highlighting that because you're right. Healthcare leaders, nurse managers, all of them, we go into it not for the pay, Lord knows. It really is a calling to take care of others. So I love that you extended grace to that. That's beautiful. Yeah. If you could maybe give us the short version, but how did you get into studying and improving well-being specifically in healthcare?
I did not take a traditional path, that I can tell you. So I did flight safety for a long time during my training, and we went from flight safety to patient safety. Right out of my training, I was hired by Johns Hopkins to do that work in patient safety and quality improvement. What we learned along the way, I'm going to skip over some details here, but what we learned along the way is that those work settings that had burnout had extraordinary difficulty rolling out quality improvement projects. And so we started using a well-being assessment at the front end of quality improvement to understand the pace and intensity that a given work setting was going to be capable of when rolling out some new protocol or some new checklist. And that taught us so much about, in Maslow's hierarchy of needs, you got to have gas in the tank to do something different.
Right.
So we're just but we figured out the right order to ask things in. And so that's why I shifted kind of slowly from quality and safety to, well, how do we put gas back in the tank? And
Mm.
that opened up a whole new field of, well, what should we be looking at as interventions? And let's make sure that these interventions work on busy, tired, cranky healthcare workers.
Right.
And that's what kind of got us here.
And it's pure gold. And I love that you kind of landed in it unintentionally, but it's pure gold because you've been doing this work for a long time. A lot of people know about Duke and their wellness focus. I mean, globally, not just nationally. And yet, that we still see this in practice where people are pouring all of these process improvement projects, quality, like we're all trying to make the spaghetti stick, but very few organizations continue to put the person first and think about how much change can they really handle. So I love that you guys continue to beat the drum on that because it's very real. Absolutely.
Yes.
So so when we talk about well-being, I just want to contextualize it. What does poor well-being actually look like in a healthcare leader's day to day? We know about fatigue and, some of the physical
Yeah.
symptoms, but what are some of the other symptoms?
Well, can I ask? I want to answer that question in a very specific way. So the question is, what does well-being look like in a leader or in a healthcare leader, or,
Yeah,
or let's just say,
or poor well or lack thereof. Either one. Either one. Yeah.
so. So let me ask and answer a slightly different question.
Yeah.
If you are a healthcare worker or healthcare leader that is struggling with well-being, what does that look like? And the way we know this is because we use a standardized metric called emotional exhaustion. So if
Mm,
I measure, I'm going to ask you questions like, agree, disagree. Do you feel frustrated by your job? Are you working too hard at your job? Do you feel burned out from your work? These kinds of things.
yeah.
If you're saying yes, 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 that's burnout. That's
Mm,
emotional exhaustion. Now, if I know that about you, whether you're a leader or not, if you work in healthcare, if I know that about you, guess what else I know about you? I know about your likelihood to get into a car accident on the way home from work.
mm,
I know about your immune system function. I
mm,
know about your marital satisfaction. I know about your length of stay, your standardized mortality ratios, your infection rates, your medication error rates. I know about, your intentions to leave, your intentions to reduce your effort. I know about your disruptive behavior
mm,
vulnerabilities. I know about all these things just by answering, just by getting that one thing from you. We
yeah.
get deep insight that goes way beyond your role in healthcare, but kind
Yeah.
of it tells us a lot about your vulnerabilities just
Yeah.
in general. And
Yeah.
I like to think of emotional exhaustion because we do this on school teachers and we do this on people in software companies and people who work in healthcare. It's agnostic to application, but the neat thing about it is that it tells us, in my view, this is how I interpret it, this is how I talk about it. It just gives you a signal of your ability to do stuff.
Yeah.
So if you're highly exhausted, your ability to do stuff is compromised, and that's going to show up in every realm of your life.
Right.
So that's where I would. It's not just patient care. It goes beyond that because it's affecting you at your core. It's affecting your charge in your battery, which is going to show up anywhere where you need to use your battery.
Yeah. I so appreciate you painting that picture because you're right. It's funny you mentioned this from a holistic perspective. Work is one part of our life, but it's not
Yeah,
all of our life. I forget who I was having this conversation with, but we talked about, life is a give and take, how much time and energy we pour into each part of our life. And yet all of it wraps up together at the end of the day for us. And we have to process it and carry that. And so I really appreciate you pulling that together in that way. That was great.
sure.
Where do you think leaders specifically, because we have so much data on the clinicians, rightfully so. They're the ones doing the important job of caring for human beings. But for the leaders who are caring for those clinicians, where do you think they might unintentionally be making this worse for themselves?
I think leaders usually under value the impact they have on the well-being of everyone that reports to them.
Mm,
Very, very consistently across work settings and across health systems, like you name it.
yeah,
What I find to be interesting is if you say, and we found this at Duke, if you're a nurse manager and you say you can sleep when you die, kind of bathroom breaks are for the lame in the weak,
right.
there's no need to eat during a 12-hour shift. That shows everyone else that self-care is not on the table.
Mm,
If you are a leader that says, I'm going to take a bio break because that's what we do to be there for our patients. If you say, it's important for us to go to the bathroom, it's important for us to take breaks and step away so that we can be there for our patients when they need us most. The difference between denying self-care and role modeling self-care is everything in the way that gives permission to the staff to say, that's what leaders do.
Right.
Leaders eat meals at meal times and leaders pee at work.
Yeah.
That's what leaders do. So that's just, I think it's a common misconception that I have to be tough. I have to forego all my personal needs. And it doesn't seem the right message.
So I want the listener to hear this very clearly. I'm going to repeat it. I don't do this often. You are role modeling, whether self-care is okay or it's not. I just want you to hear that. So I want to repeat that. You are role modeling that for your team. So if you want your team to take better care of themselves, it starts with you, my friend. So thank you for that, Bryan. That was awesome.
People are watching. People are watching.
They are. Yeah. What did you see? And I know the pandemic's over, but for me, we are all still seeing the ripple effects of the pandemic on society, on politics, on our economy, but specifically with healthcare leaders, we're still seeing the long-term effects of trauma. Was there anything you saw during the pandemic that changed how you think about leader well-being?
About leader well-being. I think it changed. Well, it's funny because if I look back to just prior to the pandemic, 2019, 2020, there were still senior leaders that I would work with that would say stuff, well, I didn't become the president of this hospital to worry about the work-life balance of the damn nurses, says no one now.
Right.
But they were saying that just a few years ago. That was like an okay thing to say in a room full of, mixed background leaders.
Yeah.
So what I think has happened is there is a dramatic increase in awareness and acceptance of the well-being as a factor. Like in Maslow's hierarchy of needs, we got to make sure that they feel safe before we give them something special and different to do, right? So let's make sure that they can inhale and exhale before we tell them to work harder. The difference now is that despite the fact that the awareness is up and the recognition is up, the options for leaders to choose from are not clear. So I got to do something. I don't know what to do. I hear that every day. I got to do something. I don't know what to do. And now it's made more complicated by doing more with nothing.
Yeah.
And I don't even know what the more is.
Right. And where they're going to pull that from. It's interesting you brought that up because I say this a lot in my workshops and keynotes. Gen Z has been forcing a beautiful cultural change. I know it's uncomfortable for the millennials and the boomers, but they are not going to tolerate people who are not focused on their flexibility and their work-life balance, harmony, whatever you want to call it. They are absolutely opting out. They're willing to forego employment until they find a culture that supports them in that way. And honestly, as painful as it is, I know there are listeners who are going, Megan, you have no idea what it's like to balance a schedule with these guys. I get it. But guys, we need it. We need this disruption because our track record up until now has not been great. It needs to be disrupted. So I'm grateful that there are, whether it was the pandemic, whether it was global factors, generational, I love that we're finally shifting. It's late in the game, but I'm just glad that we're making that progress. Absolutely.
The generational stuff is fascinating, and
it is.
I agree with everything you just said. And let me add to that 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 generation, that kind of under 30 crowd, they watched their parents work their entire lives selflessly for an organization, only to be laid off on a whim based on some need of some shareholder. And that generation is like, that's not going to be me.
Right.
I don't want to be. I don't want to have a fancy title if it means I'm going to have to, work nights and weekends. And I don't want to show up at a place that's going to do all this. So you know how that shows, how that manifests in ways that we misinterpret?
Yeah.
We call it entitlement. We call it back in my day, I would have never talked to an employer or recruiter that way. What they're doing is a very intelligent response to the world that they've witnessed is you get screwed over. You get screwed over despite your loyalty. So they show up and say, I want this really high salary. I expect this. And I don't want to have to show you that I deserve it. Pay me and I'll show you what I can do.
Yeah.
That that shift in, like,
Yeah.
someone my age might look at that and say, how dare you,
Yeah.
right?
Yeah.
But it's actually a very intelligent response to a very abnormal situation that they're watching.
Yeah. Just because we've normalized it as older generations doesn't mean that they should have to. Like,
Right.
I could go all
Right.
day about that. That's so beautifully articulated. Well, we are going to pivot now into some of the strategies. So, just to orient the listeners, we're going to talk about 3 strategies. So, strategy number 1, we're going to talk about micro practices that fit into your busy day. Strategy number 2, we're going to talk about the Duke Wellbeing Survey. And then strategy number 3, we're going to touch on the Wiser tool that we used in my project that they've continued to refine. So, strategy number 1, let's talk about micro practices. So, a lot of leaders hear the term self care, and honestly, some of them will immediately just tune it out. So, let's make it real. What are some micro practices that actually work in a healthcare setting?
Yeah, there's a couple of my favorites I like to work with, and I learned about this. Let me just say, from neonatal ICU nurses, they put a wrinkle in my brain that I'll be forever grateful for.
Yeah.
They said literally, this is back in 2013, 2014, when we were starting to do randomized controlled trials, and we said we would like you to do this bite-sized well-being intervention. Would you be interested in participating in this study? And they were like, yeah, I'll check out your little well-being intervention, but I'm not going to put the baby down. If I could do it with one hand on my phone, I'll give you maybe 2 minutes.
Yeah.
But
Yeah.
I got to get back to my babies.
Yeah.
And we're like, oh, what do you mean we can't do an intervention in 1 or 2 minutes? Well, it took us like 10 years to get
Yeah.
there, but we
Yeah.
got there, and we got the dose smaller and smaller. We got it more and more. Like, what's the minimally effective dose? How do we make this more engaging? How do we keep it fun and interesting and useful
Yeah.
for these busy, tired, cranky healthcare workers? And I'll give you a couple of examples. A really popular micro intervention is called 3 Good Things.
Yeah.
So every day, within about 2 hours of sleep onset, they'll send you a text message, and it says, Megan, here are what are 3 things that today that didn't suck. Good thing number 1, good thing number 2, good thing number 3. Boom. It takes about 1 to 2 minutes to do it, and if you do this every day and we do it, our dose, we monkeyed around with this for a while, but our dose is 15 days. If every day for 15 days, you just list out, if you just look back and note, here are 3 things that went well. Despite the dumpster fire that might have been that particular day, here are 3 things that weren't awful.
Yeah.
You train your brain to see the good right next to the bad.
Mm.
And that gives you a buffer. The buffer is so powerful. It's actually better than selective serotonin reuptake inhibitors in terms of its efficacy.
Wow.
This micro intervention. So 1 to 2 minutes a day. That's what the neonatal nurses said. 1 to 2 minutes a day.
Yeah.
Just pause and say, what are 3 things that went well? That's it. And the effect lasts. We've measured this and shown the follow-up data 1 month, 6 months, 12 months later. The effect lasts 14.
Wow.
So you just have to do this 15 days a year, and you get your dose. And then you can do it again next year, and then the next year. So that's one example of a micro intervention.
That is so powerful. Why do you think, or what has your research shown either way, why are some of these small, consistent actions often more effective than those big occasional ones? Like, sorry, to clarify, like if like one time a year I get to take a big cruise vacation, or one time a year I go to a yoga retreat versus like you're
Yeah.
talking about the small daily ones. Walk me through that a little bit.
Yeah. So if you take, first of all, vacations are great for well-being for like 2 weeks.
Right.
And then you go right back to baseline.
Right.
And what vacations don't do is they don't teach you a different way of thinking about the world. They give you a reprieve from your daily stressors. Then when you return, that little buffer that you created during vacation wears down and you're right back to baseline. The difference with these micro interventions is that they don't take long. You're building a muscle over time. So and let me tell you, there's researchers at University of Michigan that did a replication study. It was a randomized controlled trial of 3 Good Things, but they diluted it. And instead of doing it every day for 15 days, what are 3 things, every day, they said, let's do 3 good things 3 times a week for 3 weeks. And they found the effect at 1 month, just like we did, but it was diluted by 3 and 6 months. It was almost gone.
Interesting.
And it's just like, but here's the thing. If you do this daily, if you do this every day, you teach your brain, You make that muscle stronger to see the good right next to the bad.
Yeah.
That is we call that skills, not pills. So nothing against pills, but you're changing the way you view the world
Right.
long term.
Right.
Vacations don't do that, right?
Right.
A yoga retreat, if it's really profound, can do that a little bit.
Right.
But again, it's where is the skill that you're developing that you can use in huddles at the dinner table, when you're in line getting coffee, when
Yeah.
you're standing in an elevator. Like these are the how do you integrate these little micro interventions
Yeah.
into an already busy day?
This is so interesting that we've touched on this because it feels like a theme. I don't know if it's because I'm in my 40s now and I'm trying to make sure I hydrate, make sure I get my steps, make sure I get enough protein, get enough fiber. Oh, by the way, you're supposed to stretch. Oh, by the way, you're supposed to go to bed early. Like you think of all these wellness things. And what's been interesting is when I pick one or two, and I just do it consistently on a daily basis. I may not hit my total protein goal or my total step goal, but I'm trying consistently each day. I have found way better results with that. And it's more sustainable, right? Because you're doing small, simple things. You're not making some radical life change. We know when people, literature shows us when they do extreme dieting, it might get them a result temporarily for an event, but it's not something they can sustain long term. And so I feel like we're touching a well being's no different, that part of our life, just the small, but it's the consistency with which we do the small practices, it sounds like, that gets us that impact.
That's right.
That's so interesting.
And you
So,
can dilute it by not do like the dose of any intervention is really important, right? It's like
right,
the frequency and the duration and the intensity.
right.
And we've worked really hard over 15 years to
Mhm.
get what is the minimally effective dose for every one of these 20 bite-sized interventions.
Yes.
And when it gets to be too little, we're like, okay, let's ramp it back up a little bit. We need to make sure
Right.
that we stay in that sweet spot.
Yeah.
And I'll tell you, this is kind of a fun like historical tidbit that might help the clinicians put this into perspective. Is Three Good Things originated in severely depressed patients
Mm,
because we were trying to come up with psychologists were trying to come up with interventions for people who had a hard time getting out of bed, had a hard time holding down a job or driving a car, and the standard kind of like journaling
yeah.
intervention. I want you to write in a journal every day for 21 days for 45 minutes a day about all the things you're grateful for.
Mm,
And guess what? Yeah, people who did that, they showed massive improvements. But in this population of people that are struggling with clinical depression, with severe depression,
yeah.
it's really hard to get them to do it once for 45 minutes, not even to mention 21 days in a row.
Right.
And so they figured out what we can do is we can concentrate that instead of saying making a list of all the things you're grateful for. Oh, I love chicken, I love lavender, and
Yeah.
I love my manager, and instead of then you can say instead name a person who's done something amazing for you. They didn't have to, but they did, and you're grateful that they did. And I want you to spend the next 7 minutes writing a letter of gratitude.
Mm,
This is how it made me feel, and this is what it says about you that you did this thing.
yeah.
If you spend 7 to 10 minutes doing that one time, this is another one of the interventions. This is called the gratitude letter.
Yeah.
If you do that one time for 7 to 10 minutes, we can measure a difference in you 2 months later using randomized controlled trials.
Wow.
That's really cool. Now, does that last for a year? No, but we're talking about one time, 7 to 10 minutes.
Totally
That's
doable.
that's where these interventions that were designed for people that were kind of they were compromised in their ability to kind of take on something new or
Yeah.
difficult.
Yeah.
And we made it so easy for them
Yeah.
that we then turned. So what if you give this to a population that's not severely depressed?
Yeah.
Guess what? Works there too.
Yeah. Yeah, so powerful. Thank you for sharing that. That's incredible. And what's helpful for leaders who are so busy and have to make these very specific decisions about where to spend their precious time and energy because they tend to put themselves last. What I find is
Right.
they're more open to trying things like this when they're small and they're able to do it consistently, especially passively, even if it's just internally in their mind. I think that's so powerful. So thank you for sharing that.
Yeah.
Let's pivot to the next strategy. So we want to talk about the Duke Wellbeing Survey. So you have developed this survey. Can you walk us through what it is and how it might help the leaders?
So in one of my roles, I'm a psychologist and a psychometrician. So I mean, a psychometrician is someone who creates metrics and then does validation studies to make sure that they're measuring what you think they're measuring. We spent a lot of time measuring well-being and coming up with new ways of measuring well-being. And we have a multi-dimensional survey that that looks at what you and I would call burnout, emotional exhaustion. That's what we were talking about before. But we also look at work-life integration. Or do you take breaks? Or do you get home late from work? Things like that. And we look at emotional recovery, which
Mhm.
is, do you bounce back after an upheaval? Right. And we look at professional fulfillment. So those are 4 domains that when you put them together, they're really powerful. And they're related to things like depression and anxiety. But more to the point, you get this really cool profile of, someone who's like high, high, low, low,
Yeah.
or someone who's low, low, high, high on these dimensions. And that tells us, ooh, you need this intervention, but
Mhm.
that person needs this other intervention. And
Yeah.
now you can use precision well-being to map the right intervention onto the right well-being need.
Yeah.
That's that's super high tech. That's super exciting. And I'm like, watch this space because that's going to be a really fun part of the well-being science to watch over the next 10 years. Very, very cool. But that's what when we say survey, we
Yeah.
mean it's multiple dimensions. It's all well-being. It's multiple dimensions.
Yeah.
And if I give you one quick example, I
Yeah.
personally have been filling out well-being surveys for a long time.
Yeah.
I'm very high, even today, I'm very high on emotional exhaustion.
Yeah.
So that means my well-being battery is actually quite small and it
Mhm.
loses charge quickly.
Gotcha.
So it doesn't take much for me to lose charge. But my emotional recovery, which is how quickly can you recharge that battery
Yeah.
when it gets low, is very high. So I don't have a very big battery, but if I lose charge, I know how to recharge it very quickly. I play pickleball, I run, I spend time with my kids. I like to spend time outside. I'm a woodworker. I spend a lot of time making things out of if it's firewood. Can
Yeah.
I take it out of the firewood pile and make something out of it? Make something useful. It's great. If I don't make something useful, it's still firewood.
That's right. That's right.
These are things that I do to put gas back in my tank. And so what happens is when you have a multi-dimensional well-being assessment, you can really target what types of interventions and activities are going to land with a
Right.
group of people and which ones are going to be less likely to land. And there's not one thing. If you do this one thing, everybody gets better. We've been looking, can't find it. I've been looking for 30 years, can't find it.
Preach. Preach. That's incredible because as you're describing it, I'm like, oh, he's describing precision medicine just in the psychological space. I think that's why we've struggled so much. This is my belief, having experienced this. I think healthcare leaders are a little unconvinced, maybe and even a little jaded because we've been talking about burnout. We've been talking about well-being. No one has found what you described as the magic bullet. Well, here comes a tool that has been psychometrically validated that
Hmm.
tells them what kind of intervention works for them today. And if I were to take the survey 6 months, a year from now, I might have different results, right? So it's
Yep.
helping us really say, okay, of all the micro practices of all the things that are out there, like the person you talked about in the beginning, I know it and something needs to be done, but I don't know where to start. Sounds like this tool really helps them figure out where and how to start in a guaranteed impactful way, which is not something we've experienced before. So I'm super excited about this tool.
Yeah, it's as close as I can come to kind of like a one size fits all
Yeah.
approach because we all start with the same assessment,
Right.
but we end up with different recommendations.
Right. Right. That's so powerful. And before I know we're already getting close to time, but before we talk about or kind of close out, I want to touch on the Wiser tool. And the reason I am so passionate about it is because I saw the power of this intervention during the pandemic in nurse managers. So you talk about a high risk group that already has a super stressful job, then you put us in this global emergency. Even using this tool just a little bit made such a difference for them. So if you could kind of touch us on what that tool is and maybe where they could access it, that would be amazing.
Sure. So still on the website, it's completely free. It even has continuing education credits behind it.
Mhm.
So we call it a multi-tool. So we actually took a number of different interventions that were all bite-sized and we put them together. So every day for kind of 1 to 2 minutes for 10 days, we give you a slightly different task. At the end of the 10 days, you've been exposed to the 3 good things intervention. You've been exposed to the gratitude intervention. You've been exposed to the random acts of kindness intervention. You've been exposed to the awe and wonder intervention. And you can choose along the way, you can kind of choose your own well-being adventure. Like which thing do you want to do more of? Which thing do you want to do less of? But it gives you it's kind of like a poo-poo platter, if you will,
Yeah.
of kind of where are you, or at least you get to test
Yeah.
out a number of different things and see what fits. And we had developed that before we got to the point with the profile work, with the wellbeing
Yeah.
profiles, where we could kind of direct. Still available, costs nothing. We've published it with 2 randomized controlled trials. Both of them showed, significant improvement at the 1, 6, and 12-month posts. So it's got good data behind it. And if for no other reason, go and grab an hour of CEU with CME credit.
Yeah, absolutely. Absolutely. Pure gold, pure gold. Well, I cannot believe we're already getting close to time, but I like to end the episode kind of on a lighter note because we're always talking about pain points and we're kind of really focusing on what's broken, but I like to end on a higher note. So what is maybe one daily habit for you that's had the biggest impact on your well-being?
So this is a rare thing. I don't think it's not easy to say which one thing everybody can do, but this is a really special one. And don't roll your eyes,
I
but
will not.
everything in life is more difficult with a terrible night's sleep, and everything is more difficult. Everything is more easy. Everything comes more easily to you with a good night of rest. So we have a sleep tool that I love to kind of put in front of people, even if I don't know much about their background.
Yeah.
And it has like evidence-based sleep hygiene tactics that you can use. And my favorite one of all, if I can leave this with your listeners, is called 3-2-1. So 3 hours before bed, no more food. 2 hours before bed, no more liquid. And 1 hour before bed, dim the lights and move to screenless reading. If that's the only thing that you do,
Yeah.
watch how much more easily you fall asleep. And if you wake up, fall back asleep. Just try it out. Try it out.
Love that.
That's one really, and I do that myself. If I'm like, oh my gosh, today, try that out. That's delicious.
Thank you for sharing that. You're right. We all need help with our sleep. We are terrible at it. I don't know anyone who sleeps well consistently. So thank you for that. 3-2-1, so easy to remember.
Yeah.
Well, thank you. Thank you for sharing so much wisdom with us today, Bryan. If our listeners want to connect with you further, where would you like me to direct them?
We're on LinkedIn. Our website is cause.dukehealth.org. The cause is CAWS, the Center for the Advancement of Wellbeing Science, caws.dukehealth.org, or you can find us on LinkedIn.
Love that. And just so you know, listeners, the links to that website and his LinkedIn profile will be there. I'm also going to summarize all the Chaos Whispering practical tips that Dr. Sexton just shared with us. Bryan, thank you so much for your time today. You continue, and the work that you do continues to impact me and the leaders that I work with. So keep doing what you're doing. You are changing the world one leader at a time. Thank you so much for your time today.
Thank you for having me.
Awesome. All right. We'll see you next time, Chaos Whispers. Thanks for joining us on the Chaos Whispers of Healthcare. If today's episode resonated with you, please be sure to follow this podcast, rate, and leave a review on your favorite platform. I'm Dr. Megan Carter, and I will be back next week with more real talk, fresh strategies, and guests who are redefining what it means to lead with impact. Want to keep the conversation going? Be sure to connect with me on LinkedIn and download free tools and resources from my website. Both links are in the show notes. Let's heal this broken healthcare system together, one day at a time.